I tend to be a little aggressive with the testosterone to start off with, just to kind of get them out of that rut that they're in. Because if I get them feeling better, they're going to be more willing to listen and be more compliant. I treat more of the patients how they feel, not so much the numbers. To look at food as fuel instead of for taste, you won't have to lose weight again. You'll live a healthier lifestyle going forward.
Yeah.
You're going to be much happier. Then they'll have to get medicine involved, like antibiotics and such. So the vitamin infusions have done wonders for everybody.
So welcome to the TRT and Hormone Optimization YouTube channel. And today we have a new guest, Sam from Invigorate Wellness. Welcome, Sam.
How you doing, Dr. DeVos?
I'm great, thank you. I'm glad to have you. And
Thanks
because
for having
it's
me.
the first time on our channel, maybe introduce yourself. So what do you do for, where do you work from?
So I'm in Tampa, Florida, and I have a small medical practice, Invigorate Wellness Medical. I do IV vitamin infusions, testosterone replacement therapy, weight loss, and peptides.
Okay, awesome. And weight loss, is that by giving out workout plans and diets, or is it also the whole thing, hormones included?
So I use Semaglutide currently, and I do have a diet plan that a registered dietitian wrote, and then a workout plan that I send with it.
Awesome. So let's start off with the first question regarding TRT. So many men go on TRT because they have low T, of course, and they are suffering from low libido as one of the many symptoms. But in some of them, the testosterone levels go way up and all the symptoms disappear, but the low libido remains. How do you go about tackling this?
So I like to look at labs, the patient presentation, diet, sleep, exercise, hydration, supplementation, stress. All those can play a role and affect everybody differently. Currently, I don't have any clients with those issues. However, if I did come across that, I would probably dabble into the hybrid method that's becoming popular, which would be maybe reduce the twice a week shots or whatever frequency I have them on at the time, and then we add in some testosterone cream daily.
Okay, that seems like a great idea. Okay, and how about the labs? What are you looking for, especially if the men suffer from low libido?
I mean, I check all the extensive labs, the free, the total, SHBG, vitamin D is important. I check that and supplement accordingly. For vitamin D, I shoot for a level of 80. And then really it's just overall how they feel. I treat more of the patients how they feel, not so much the numbers. Yeah.
Okay. And are there any peptides that can help with low libido if all the rest is corrected?
The one I'm familiar with is PT-141. I haven't used it myself. A couple of people have tried it. Seems to be with some peptides hit or miss, whether they work or not. So it's a risky investment, but if they work great. If they don't work, it's kind of a waste of money.
Okay, interesting. Okay, the second question there. Since there are so many peptides nowadays, what are the best ones and how to use them at what doses to lose weight? Because even in our journals last week, there was a whole bunch to do because a lot of doctors prescribe peptides to lose weight, but even in patients that are not diabetic. And they said on the news, it should only be prescribed for diabetic patients. So how do you go about it?
So I've had a lot of success with semaglutide, and it's a healthier lifestyle. My approach to, the weight loss is if I can change the mindset to look at food as fuel instead of for taste, you won't have to lose weight again. You'll live a healthier lifestyle going forward. So I've had a lot of success with the semaglutide for weight loss. Now, in conjunction with TRT patients, I'll use CJC 1295 and ipamorelin. Sometimes I'll get a patient that needs help sleeping, wants to lose some weight, wants to recover faster. That peptide is perfect. It hits all three. So it's one peptide that can do multiple things. So I'm a huge believer in the CJC 1295 and ipamorelin. Semaglutide for weight loss. There are some other ones, but not as good. Seems like semaglutide's working well. You got some new ones coming out that seem pretty promising as well. So that's how I go forward with everything.
Mm-hmm. And can you also prescribe it outside diabetic patients?
Off label, I do. Yeah.
Yeah.
Yep.
Okay, third topic. I've heard doctors state that TRT and hormone optimization is just the cherry on top. And there are doctors that say you first have to correct your weight, your diet, you have to start working out, sleep hygiene, and so on. And then we can start taking a look at TRT or hormone optimization. How do you go about it? Do you start them on TRT first, or what's your call?
So my approach is, again, looking at everything, diet, stress, exercise, sleep, all the factors that could affect somebody, even mental state due to stress or some emotional thing that somebody might be going through. So I look at those factors because to me, it's like puzzle pieces. So we put the big puzzle together. Now, if you have low T, you're not feeling good. You're not going to want to work out. You're not going to want to do anything. Now, if I can switch that to an upward spiral by supplementing TRT, and I get you feeling better, you have more energy now. Now you're going to be more willing to do something to change your life. Mm-hmm. So that's kind of the approach that I take.
Mm-hmm. Okay. So what kind of supplements do you recommend to start off next to TRT? Is it also vitamin D, C?
Well, with the current events going on and doing hand in hand with the vitamin infusions I do, I pretty much tell everybody to take zinc, vitamin D, D3 with K2. Let's see, vitamin C, zinc, D3 with K2, anything they're deficient in. And I tend to be a little aggressive with the testosterone to start off with, just to kind of get them out of that rut that they're in. Because if I can get them feeling better, they're going to be more willing to listen and be more compliant, even if they don't want to change their lifestyle and just live an unhealthy lifestyle. I feel they're just stuck. Mm-hmm. So if I can help them, see it from a different point of view and understand it by explaining the reasons behind stuff and rationales, mm-hmm. they're more compliant that way.
Okay.
Sometimes just making somebody understand something is enough to make them listen.
Mm-hmm. Why are you using vitamin infusions instead of orals? Because of the absorption?
Correct. So taking vitamins by mouth with a healthy gut, you absorb about 30%. Doing them at the IV, you get 99% absorption, works immediately, you get instant gratification, recovers sickness, prevents from sickness. So with COVID and all this other stuff going on, very effective.
Are a lot of people open to that because it's a more invasive route than just taking some pills?
Yeah, I mean, you got to factor in pricing. My IV started at $160 for an IV per person. So you got pricing to factor in for some people. The general clientele I see is they're more health oriented, so they want to invest into their bodies. Mm-hmm. They do take daily supplementation because something's better than nothing. But then they do the vitamin infusions, whether it's weekly, bi-weekly, once a month, whenever they need it. It just depends on their regimen. But it's definitely effective to do it from a proactive standpoint, because I also believe if I can keep somebody healthy, they're gonna be much happier. Then they'll have to get medicine involved, like antibiotics and such. So the vitamin infusions have done wonders for everybody.
Awesome. I just heard you talk about the COVID stuff. I'm not going, I can't call it a crisis, so that's why. What are your general recommendations for supplements for the immunity? Zinc, vitamin D, quercetin, I guess.
Yeah, you can use the quercetin. So the main ones is the vitamin C, the zinc, the D3 with the K2, hydration, rest. Your body repairs when it's sleeping. And then as far as symptoms, just treat the symptoms accordingly. You have a sore throat, start with the warm salt water gargles. Mm-hmm. 9 out of 10 times, that's enough to prevent an antibiotic use.
Mm-hmm.
You know, so these holistic approaches I use first as interventions, and then if I need an antibiotic or something like that, fine. And most people are very receptive to say, all right, let's do it this way first, or their way, because they're holistic. When they want to do it their way, that's fine. It works, it's effective. 9 out of 10 times, they don't even need an antibiotic. But if they did need one, and they're more open to it at that point, because they're like, okay, we've tried everything, now let's do it this way.
Mm.
So
okay, thank you so much for all the great answers. If people would want to work with you in the region, how could they reach you there?
So they can check out the website at invigorate-wellness.com. We're on Facebook, we're on Instagram, got some YouTube videos.
Mm-hmm.
And then they can call or text the office at 727-456-8686.
Okay, I will leave those data in the description of the video. Thank you so much, Sam.
I appreciate it. Thank you.